We're here. Clock out mentally at least and pull up a chair because this isn't just a podcast. This is where we come to lay the burden down. This is where we talk about the things nobody wants to chart. Welcome to the Broken Shift, where the codes are emotional, the tea is hot, and the trauma, oh, it's documented all over our bodies. I'm Nat, also known as the Bedside Rebel, and when I tell you we're about to go there, baby, I mean it. Every shift, every scar, every story that keeps us up at night, this is where we talk about it.
Why are people so mad about illegals losing their Medicaid?
Hi, my name is Charles. I have done medical billing and coding in the state of Texas for over 20 years. I'm actually really qualified to answer this question for you. Let me just start off answering your question in the broader sense of things. Why are we so upset that millions of people are going to lose access to affordable health care? It's because health care is a basic human right. We should all have access to affordable health care. You complain about how expensive your insurance is, and sister, I feel that my insurance is ridiculously expensive too. But we want that for everybody. You, me, guy next door, we want affordable health care for everybody. But more to like your specific question. Undocumented immigrants in the United States do not qualify for Medicaid. They just don't. And if it does happen, the very rare case that it does happen is because there has been a catastrophic accident that has happened and they require life-saving care. And even then it's granted like 3 days at a time. It's not like they get on it, stay on it, and sponge off the government. That doesn't happen. But let's talk about who actually is going to be affected if this goes through and people lose access to Medicaid. First and foremost, rural healthcare in the United States will be obliterated because these clinics that are in these smaller communities rely on Medicaid funding because let's face it, if you live in a rural area and you have access to insurance that is not Medicaid, more than likely you have the ability to go to larger towns and get the care that you need. If you are on Medicaid, you rely on those rural clinics to get the care that you need. So if funding is taken away, people lose their health care coverage, those clinics are also going to shut down. Not only is that taking health care away from people, that's also taking jobs away from people. Who else is going to be affected? The elderly and the disabled. We will be taking away life-saving care from people that rely on Medicaid to pick up what Medicare doesn't cover. Or if they're entirely disabled, what Medicaid pays for like assisted living, all of that is covered by Medicaid. Who else is going to be affected? Foster kids in general, but specifically foster kids that have Medicaid, at least in the state of Texas. I'm assuming that's countrywide, but I can speak from personal experience as a foster parent. We had to drive 2 hours to find somebody that could do an optometry check for a child because there were no providers here locally that would accept the insurance. Now, thankfully, we were able to drive 2 hours to go and get that taken care of, but can everybody? No, they can't. And if your child has Medicaid, you can't pay out of pocket. It's illegal. So ultimately, who is this going to affect? Let's recap. Poor Americans, middle-class Americans, disabled people, elderly people, children. That's who it's going to hurt. Who's it going to benefit? Not you, not me, not middle-class Americans. It's going to benefit billionaires that are going to be getting a massive tax break because of the cuts that are coming from the Medicaid programs. That's who's going to benefit from this. I say this with genuine, sincere hope that you listen to this and that you understand what I'm saying. If we want healthcare in the United States to change, it doesn't start by taking healthcare away from people that desperately need it. Where the change starts is by holding insurance companies accountable.
Welcome back to the Broken Shift, by the way. My name is Natalie, and I haven't been here in a while, and I saw something which just breaks my heart. And you can read it, as you can see in the title. You know, a patient coded in the waiting room, and he or she eventually died. Or, and I'm going to read this to you. You know, you may or may not see many of these stories because of patient confidentiality. So, you know, nurses can't just go on like TikTok and and make TikToks, right, at work about this because they'll get fired. But what's really sad about this is that we're looking at all these cuts that are being made to like Medicare, Medicaid, and you know, hospitals that are going to close. And I just feel like this situation is going to get worse. This is a situation that any of us can encounter. You know, anyone can encounter this. My husband had a heart attack about almost 8 years ago, and We went to the emergency room in my hometown. The emergency room was empty and there was not a nurse to be found. Now, being a nurse, I immediately I walked back into the emergency room and said, "Hey, my husband's having chest pain." Um, they were pretty empty, but in the triage area, there were no nurses. There was no one in the triage area. It was about 3 o'clock in the morning. And so this really hits home for me, and this really hits home as to what many of us are going to be, what's going to be experienced, um, what we're going to be experiencing with healthcare and emergency room visits as hospitals close and healthcare funding is removed. So I'm going to go ahead, drop me a comment, drop me a stethoscope down in the comments for support, and drop a comment and let me know what you think about this. If you're a nurse, let me know if you can what you've experienced. So here we go. I had a patient come in with chest pain and normal vitals. So he was told to wait like everyone else. Okay, I'm going to stop there. You have chest pain. The first thing I would think that we do when somebody has chest pain is we get them on a monitor, right? We put them on a heart monitor and we draw labs. You draw enzymes to confirm or not confirm. I mean, for heaven's sakes, the person is in the emergency room. Now I know when I was pregnant, I had, I felt I had what I thought was chest pain, and I went to the emergency room and they said it was indigestion, but they did take me back. They put me on the monitor, and obviously they could see I wasn't whatever, I wasn't coding. And I wasn't having a heart attack per the monitor. I wasn't having an active heart attack. And I can't remember whether or not they drew enzymes, but I'm sure that's protocol. There's a protocol for chest pain. Um, this is on a nursing subreddit, so she doesn't say what hospital, obviously, because no one wants to get fired, and so this is very anonymous. But the thought of this just makes me cringe, and it should make not just you nurses out there cringe. It should make everyone who comes across this just cringe for their own life and for the life of their loved ones. Okay, let's continue. Hours later, he came back to the triage feeling worse and then just collapsed in the waiting room. CPR was started immediately, but we couldn't save him. The ER is packed beyond belief. Rooms are full. Waiting times have stretched to 10 plus hours, and staffing is at an all-time low. Nurses are quitting or calling out sick, and replacements are nowhere to be found. It's heartbreaking and exhausting. I'm scared, frustrated, and honestly don't know how much longer I can keep doing this. How do you keep going when the system feels so broken? I talked a lot about nurse abuse on this channel, and I stopped for a while because it is exhausting. It's not, you start going through these stories and you think, well, how much more can we take as nurses? I mean, I personally don't work in the hospital and have not worked in a hospital setting for over 10 years, over 12 years, maybe a little bit longer if I really count back. And when I read this, it's just heartbreaking. It makes me want to cry. It makes me think of your family. It makes me think of my family. And the worst part is that as medical and healthcare workers, right, whether you're a doctor or a nurse, are you immune to the same type of treatment? Or maybe you get better treatment when you come in and you say you're a nurse. And I was like that person that would never go in and tell anyone I'm a nurse. But now I'm like, if I go to the emergency room, I'm going to say I'm a nurse. If I go in with my family, I'm going to put it out there that I'm a nurse. I'm going to demand enzymes. I'm going to demand an EKG stat immediately. But what about those people who don't know what to ask for? Who don't know that it's protocol to draw enzymes to check for elevated enzymes um, in the event of a potential heart attack. Who don't know that you could put on EKG to see if someone is having an active heart attack. Someone, and these are, I'm gonna give you some responses from other nurses, and I would love it if you would drop yours, because something's got to give. Like, I don't understand. We're trying to save money, but we're cutting healthcare, and this is what's happening. It's like, are we trying? Are we doing, like, is this how we're doing population control? I mean, I hate to say that. I'm not being a conspiracy theorist, but my goodness. You go, what do they tell you to do if you're having a heart attack? Go to the emergency room. You know what I say right now? If you feel like you're having a heart attack, if you're having chest pain, don't do a walk-in. I don't care. Call an ambulance. That's what I say. Call the ambulance, because I'm going to tell you this right now. On the ambulance, the medics will come. They have heart monitors. As soon as you say you have chest pain, they will check your blood pressures. They have medication that they have things that they can medicate you with. They can give you nitroglycerin, right? They will, the first thing they do, and if you're at home, I'm not a doctor, I'm not telling you what to do. Check with your doctor to see if this is okay, because I don't know what your medical situation is. But take a baby aspirin and crush it and put it under your tongue immediately if you think you're having a heart attack, and call the ambulance. Do not drive to the emergency room. Some of these ERs are booked, and they have a triage nurse. I don't know how long that triage nurse has been a triage nurse, how long they've been a nurse, because the turnover is ridiculous. And I mean, short of like some other type of active emergency, right? You come in, you have somebody has an accident, but you used to be that chest pain, angina, chest pain, someone having an active heart attack was a priority in the emergency room. That's why you go. So please, if you're watching this, you need to call an ambulance if you're having chest pain. Do not drive yourself or your loved one. Do not drive your loved one or try to take yourself into an emergency room. Call the ambulance. And I know it's expensive, but my goodness, this could save your life. Someone says, an ICU nurse says, we keep saying the only way admin is going to change anything is if this were to happen to a VIP. Isn't that a shame? So we have to wait for it to be like the CEO of the hospital that comes in that it happens to. But see, here's the thing. Probably a CEO of a hospital that comes in would never get this treatment. See, me going in as a nurse and telling them I'm a nurse, I can sort of almost guarantee I'm not going to get this treatment, because I know how to bitch, and I advocate for myself. I'm just afraid for those of us out there who don't know how to advocate for ourselves, who don't have the education or understand what the protocols might be. And it's a shame. It's such a shame. Here's what a cath lab nurse says. An ER nurse says the VIPs would never see it because they go straight to the back and they get a one-on-one nurse in the quietest room. No wonder nothing changes if that is their perspective. Yeah, exactly. So the VIPs go back. I mean, I might not get one-on-one care because I'm not a VIP at the hospital, but I can go in and raise some hell, right? Like when I went in with my husband and there was no one in the emergency room, I went back to there was no one in the triage area. I went straight back into the ER and yanked someone and said, "Hey, I'm a nurse and my husband is outside. He's having an active heart attack. I need help now." And so, most people are just, they're going to get told to sit, to wait, to sit, and no one's going to, they don't have anyone to advocate for them. They don't know to ask, like, can you at least do an EKG? Can you know what? And it's so sad. Someone from a cath lab nurse says, not on my watch. I've made them wait in the room like others. They can cry and bitch, but no special treatment. She's talking about the VIPs. Yeah, but the thing is that you'll do it to them like you do to others. But the truth of the matter is that whether you're a VIP or whatever that is, like I guess you consider a VIP a CEO or somebody that has like some status at the facility, or like maybe like somebody that's like high profile that comes in, right? But whether you're high profile or you're someone like me or someone like you who might be watching me, why is it that we don't deserve the same kind of care? That's the whole idea. But the thing is that what they're saying here is that as long as the VIPs are not affected by this, they will not change the policies, because most of the time they get different and VIP treatment. Someone says chest pain should always have an ECG regardless of normal vitals. Exactly. And I was not an ER nurse, although I did work. I worked a cardiac unit, CCU, cardiac care unit, and yeah, PCU, patient. Um, I forget what it was called, but cardiac care. I've had ACLS training, so you know what the protocol is. And even if not every nurse goes through ACLS training or has worked cardiac care, you know that chest pain is just something that you don't play around with. Everyone should have an ECG because normal vitals does not negate the fact that you could be having abnormal P waves, which is your EKGs could be off and showing you because you can see if for those who don't know, like you could have your EKG, the different waves in the EKG or ST waves, I should say. I said P waves. It's been a while. S Abnormal ST waves, which could show that you're having a heart attack. Wow, your ECG was normal. Um, Someone else says, and labs. I'm a nurse who had a widowmaker and my ECG was perfect. Labs were terrible, of course, but because I was in my 30s and a female, I sat in the waiting room fighting for my life until my my troponin levels came back. That's one of the markers for those. That's one of the enzyme markers for a cardiac arrest. I'm gonna actually put in the description box. I'm gonna put down the labs that they draw for and the protocol if you're having chest pain. But I say, my suggestion to anyone who gets to see this, if if you are if you feel like if you're having chest pain and you're not sure, do not drive yourself. Do not have someone take you. Call the ambulance. Someone says, I am not a medical professional, but I have had a heart attack with normal vitals, normal levels of consciousness and awareness. Thank God I hit the ER at 4 a.m. because they did not take me seriously being young and visibly physically fit. They kept trying to tell me to take an antacid, and I had to fight to tell them that I know what acid reflux feels like, and this is not it. Exactly. Like I told you, I guess it was acid reflux, but that's one of the things. A lot of times when you're young, I was young. I was how old? I was in my 20s, my first pregnancy, and I went to the emergency room, and that's exactly what they said. Oh, you're pregnant. You have acid reflux. Why? What does it cost them? Yeah, and I had insurance. I was insured, so why not do the tests to check? Why risk it? And then she says after all of that, she did all this fighting. Um, they kept trying to tell me to take an acid. I had to fight to tell them that I know what it feels like. That's not it. She had 100% STEMI in her right, in her RCA, in her right coronary artery. So, point is, thank you all that get nervous as hell the second you hear the word chest pain, regardless of age and physical appearance. Yeah, it makes me nervous. Like, don't, if somebody tells me I have chest pain, nobody is like trying to run to the emergency room to say they have chest pain. But if somebody, and you know what, and women sometimes show up and they don't have the classic symptoms. They have the pain. Women have the pain across the back sometimes. And so it's not like active chest pain. You know, Yep, my father had a massive heart attack when he was 36, still kicking, thankfully. Pretty active and healthy otherwise. I get very frustrated with providers that don't have the same level of concern for chest pain in young patients, which they have for older, more typical cardiac patients. I can only imagine if it was my mom at 36 going through that. Exactly. So a 36-year-old male might get a little bit more attention because men tend to have, but women can too. And why not? I don't have very much more to say about this. This is a PSA, I guess, public service announcement, and just a concern because, you know, nursing shouldn't break you, and it shouldn't break our patients either, right? But as you saw in the statement, like the nurse is overworked. She's a 10-hour wait in the emergency room, and a patient comes in with chest pain, and we just ignore them and we put them back. and tell them to sit until they're actively coding and having a heart attack in the waiting area and we can't save them. It's very unacceptable. Anyway, I don't know what the answer is. We can just keep talking about it, I guess. But it's just very sad. And nursing staff in the hospital is becoming scarce. And we're taking away funding from healthcare. I don't know where this will lead. But anyhow, thank you for joining me on The Broken Shift, and drop me a comment, support, subscribe, and I will see you in the next one. This podcast is for everybody who's ever had a 5-minute lunch, a full bladder, and a full patient load, and still managed to hold someone's hand while they took their last breath.
Yeah, you. And the ones who've had to file an incident report about a supervisor, you know who you are.
Every week, we're breaking down what's really happening behind the scenes in healthcare. Burnout, boundaries, bad management, and the battles no one talks about until now.
It's not just a podcast. It's a place to be seen, to exhale, to say, damn, I thought I was the only one. You're not.
So welcome to The Broken Shift. Let's talk about it. Then let's do something about it.